we'll give it another minute. So welcome everybody to the Upper Arlington Commission on Aging. New to Medicare, the fine print. My name is Jennifer Monroe Siga, and I'm the director of the Upper Arlington Commission on Aging. And I would like to introduce our panelists today, Emily Clugston from Senior Servicing Company and Marcia Strall from ElderLife Solutions. Not only are they professionals in the world of Medicare, and that they are also stellar board members with the Upper Arlington Commission on Aging. So we are very fortunate to have them on our board and to share their knowledge of Medicare, which can be a little daunting. So with that being said, I am going to turn over the program to Emily and Marcia.
So thank you all so much for joining us this evening. In the bottom of your screen, you should see a chat function where if you do have a question, please feel free to ask, and we will do our best to answer those throughout the presentation. Jennifer will chime in and ask those as she sees them, or we will answer as many questions as we can at the end of this session. So thank you all so much for joining us. And first and foremost, we really wanted to thank our sponsors. So the Upper Arlington Commission has multiple sponsors, so we just wanted to give a shout out to them for making presentations like this possible. So with Medicare, individuals often ask, why is it so important to know the decisions that you're making when you're turning either 65 and electing Medicare coverage, or if you are retiring and maybe electing your benefits post 65. But the estimated healthcare costs for a retiree is around $285,000 for a couple. So that's medical and healthcare costs. And so our job as Medicare professionals and volunteers is to really assist individuals in limiting their financial exposure. So for a female, as we tend to live a little bit longer, it's $150,000 over the course of their lifetime. And for a single male, it's $135,000 over the course of their lifetime. And these were numbers that were put out by Fidelity in 2019. So I'm imagining that they've gone up just a little bit, but hopefully not too much over the course of the year. And so with Medicare, there are three main parts. You have your Part A, your Part B, and your Part D. And so I wanted to talk a little bit about those parts and why it's important to understand what parts of Medicare cover what services. So for the hospital, I think of Part A as acute care services. So that's your hospitalization. If you were to need a skilled nursing facility stay, most of the time you do need a 3 inpatient midnight stay in order to have Medicare cover your skilled nursing facility stay. Right now with COVID, there is an exception there, and they are not requiring that for certain circumstances. And then also for home health care, if you're in a home setting. So that's physical therapy, occupational therapy, speech therapy, and then also your hospice services are covered under Part A. For the Part B services, the emergency room is covered under Part B. And the reason that we mention that on this slide is that oftentimes individuals think because the emergency room is typically tied to the hospital, that would be covered under Part B. But with the emergency room, I think of Part B as any outpatient services. So if you needed skilled therapy outside of the home, so if you were going to a clinic to receive any rehabilitation, your primary care physician, any specialists that you would see, also any durable medical equipment. So that's a cane, wheelchair, walker, hospital bed. If you have a CPAP machine to help you sleep at night, an insulin pump, the insulin pump and insulin are covered under Part B. Also, any lab work that you would receive or an MRI is covered under Part B, as well as some Part B medications. That typically includes any infusions. So chemotherapy, MS infusions, we see that either in a doctor's office, or it could also be in an outpatient hospital setting where you would be receiving Part B services for your medications. And then the one that makes the most sense is Part D, is for drugs. So they got that one right with the alphabet. And so the the reason that it's very important to know what parts of Medicare cover what service is on the next couple of slides, we will talk about the importance of the Medicare initial enrollment period for individuals who are new to Medicare, and when you might need these pieces and why it's important to know that the services that are covered under each of those parts.
And I'd interject too, in regard to the emergency room under Part B. Most people think that, like Emily said, when you're in the hospital under Part B, you feel that everything's covered, but truly under Part B, it's not. Sometimes you're admitted under observation, and under observation, any medications you get will be that outpatient cost. It's not covered 100% under inpatient. So when you get your bill, under observation, you might have a higher bill than you would under Part A as if you were admitted to the hospital. So it's always worth an ask when you're in the hospital. If doc in the emergency room says, oh, we're going to keep you for a couple days just to, make sure you're okay. Oh, am I admitted to the hospital or am I under observation? Because that's going to change your bill under either Part A or Part B. So remember that.
Absolutely. And that's a great point. We had a client call us this morning who was admitted to the hospital, and she said, what questions do I need to be asking? And so to your point, making sure whether you're an inpatient, observation, and that really can, help with the cost of your, determine the cost of your hospital bill and or what services you'll get post-hospitalization. So I always say that the easiest way to describe Medicare in my mind is we are so often used to and accustomed to group insurance. So we typically have a couple of options throughout most of our days where you can select from maybe an HSA plan at your employer or your spouse's employer, or maybe you have a couple of PPO options. Maybe there's a PPO basic and a PPO premier, but you're limited to that particular provider. With Medicare, there are over 26 prescription drug plans. There's over 44 Advantage plan options available in Franklin County. And then there's also 10 different Medigap or supplement plans that are available with a variety of companies. So the choices are extremely complex when it comes to making that determination when you're turning 65 or electing your coverage. And so I think of it when I was little, I used to put on my mom's prescription glasses and I was like, whoa, Mom, I cannot see out of this. How on earth are you able to even see? But for her, that script was what helped her see. And so if I kept on those glasses, it would actually cause more harm than good. And so that's something really to keep in mind as you are making your elections, is that we often hear, my spouse has this coverage and it works well for them, or my neighbor, or, my parents had this coverage. But just keep in mind that your specific health conditions, your preferences, are you planning on traveling? All of these items go into your decision when it comes to Medicare. So I always say, just please, talk to someone that's well-versed in Medicare to ensure that the decision that you're making is going to be the most comprehensive option for you. And that's just a cute picture. So the Medicare initial enrollment period for individuals who are turning 65 is a 7-month window. If your birthday happens to fall on the first of the month, you have an 8-month window. So for this example, if your birthday were, say, today on September 15th, your Medicare enrollment period would actually start June 1st. The other thing to note is that your Medicare benefits, if you were to elect them 3 months prior to your birth month, would actually begin on the 1st of September. And so oftentimes individuals who have a later birthday, say the 28th, 29th, 30th, they'll call us at the end of August thinking they have an entire month when they may have just a few days. So again, very important to note that your benefits would start on the 1st of your birth month, not on your birthday. And so if you do elect your coverage between June and August 31st, your benefits would begin on September 1st. If you waited to select your benefits until September 1st or the month of September, your benefits would start October 1st. And then it's important to note that while you do have additional 3 months to elect your benefits, so October, November, and December, you'll notice that there's a delay when your benefits will actually start. So it could be that even though your birthday is in September and your benefit should start in September, you may not actually receive your coverage until March, depending on when you actually elected your benefits. And that can be significant. If there is a hospitalization or, an emergency room visit or anything of that nature, any tests that may need to be done, you may be on the hook for those. The other piece to note with the Medicare initial enrollment period is that if you miss this period and you do not have a special enrollment period, which we will talk about, you must wait until January of the following year to select your benefits. And then those benefits will kick in July 1st. So again, for someone with a September birthday, if you happen to miss your initial enrollment period, you may wait almost a year before your benefits kick in. So if we miss this period, our benefits wouldn't kick in until July 1st. And that's if we made that determination during the general enrollment period. Now, some of you sitting on the call may be asking, okay, what if I plan on continuing to work through retirement, or I'm going to remain on my spouse's benefits? There is a special enrollment period for you. And we will talk about the group coverage here in just a couple of slides, but just some additional considerations that you do want to take to look at. So I always say for individuals who are turning 65, very important to note, do you need to take any part of Medicare? And if not, why? And then if you are delaying, say your Part B, because of group coverage, then you must know when your special enrollment period is. Absolutely, you can get a copy of this chart. So I'm happy to send that out. So absolutely.
And I'll just throw out too, I'm a counselor for the Ohio Department of Insurance through their OSHIP program. And there's a free resource available through the Ohio Department of Insurance. You can just call their number, and did we publish it in the back of the credits? We may not have, but I know it's on the website for the Upper Arlington Commission. And you can get a booklet called Medicare 101. The numbers in the booklet are always in arrears, of course, because they don't put it out in time. But the basics of Medicare is in here, and all of these grids and things like that, information that we'll cover today. Well, most of it anyway, not the fine print, but most of these general grids that we have on the slides are in this booklet. It's a free booklet. You can just call the number for the Ohio Department of Insurance and ask for their Medicare 101, and they will send this to you. It's also usually available in the offices at the Senior Center in Upper Arlington as well.
And they'll also, I'll interject, will be available at the main library. They will be opening up their atrium, and we will have some forms and information there also.
Okay.
Or you can contact any counselor through the OSHIP program, and they can send you one as well.
It may not have this fun little birthday cake at the end of it.
No, it's not as cute, that's for sure.
But absolutely, we're happy to share any of this information with you. And then our contact information will also be at the end of the presentation. So if you want to reach out to us with further questions, we are happy to answer those. All right. So for individuals who are currently turning 65, who may have missed their initial enrollment period due to COVID-19. So as of March 17th, all Social Security offices are closed to the public. So you are still able to contact them via fax, via mail, or to call in, but they do realize that that was an additional strain, and getting everybody set up remotely wasn't as easy as I think they thought it was going to be. So there is an equitable relief period for individuals who were trying to get their coverage between March 17th and June 17th of 2020. At this point, I have not heard that that date will be extended, but I wouldn't be surprised if we saw it extended just due to the current situation of the offices still being closed to the general public. So I do have the link here, and we can provide this for individuals if you had additional questions about the equitable relief period that's currently happening. So this is the 2021 quick reference guide that we send out on an annual basis to all of our clients. I do want to note that the 2021 rates are proposed. So these have not been released. We often don't see these rates released until later in October or the beginning of November, but these are the proposed rates based on the Medicare trustee report and some other sources that we have been privy to. So I think the most important thing to note on this slide, well, I think all of it, but are the premium rates that are associated with those parts of Medicare that we talked about a few slides ago. So with Part A, most individuals receive Part A premium free if you've worked 40 quarters, which is also considered a work credit, so 10 years, or your spouse has worked 40 work credits, then your Part A is premium free. And then you'll see here that there is a potential premium of anywhere from $263 in 2021 up to $478 if individuals have worked less than 40 quarters. The Part B premium for 2021 is a range at this point. It will be a set number, but we're not sure what that number will be. So for this exercise, we'll use $148.50. So that rate is based on your income 2 years prior, and we will talk about IRMA in a few slides, which is the income related monthly adjustment amount. But it is important to note that your Part B premium may be as high as $491.60 based on your income 2 years prior, and that adjusts every year, and they look back 2 years. The Part A deductible for next year, they're thinking it's going to be $1,452. So if you were to have a hospitalization, the first $1,452 you would be responsible for unless you had a plan that helped cover that.
Which is a Medigap plan, or what they call a supplemental plan, or if you choose the C plan, which we'll talk about later as well.
Yep, that'll be on the next slide. The Part B deductible for this year is $198. I have it highlighted in yellow because they have not proposed a new Part B deductible rate that I have seen. And then the Part D national average, they're believing, and the Part D again is your prescription drug plan, they're believing that to be $33.06. The reason that this number is so important is that if individuals miss their open enrollment period for your prescription drug coverage, there is a late enrollment penalty. And that late enrollment penalty is based on the national average premium, not on your plan premium. So you may have a plan premium of $13.20, but your penalty would actually be calculated on the $33.06. And then the Part D donut hole. So these are not the fun sweet treats that we eat in the morning. This is for your drug coverage as well. And so you have the deductible phase with a prescription drug plan, the initial coverage phase, and then you have what they call the coverage gap or the donut hole. And the coverage gap essentially means that when you and your plan have paid $4,130, then you are responsible for 25% of the cost of your generic and your brand medications until you reach the true out-of-pocket of $6,550. So some individuals, due to the cost of their prescriptions, may fall in and out of the donut hole in 1 month, or individuals may fall into the donut hole in July or August, and they are there until the end of the year. This number resets every year. And so again, not to go too much in the weeds on this, but if you have specific questions, please do ask. So the question that we have is the Part B premium based on earned income or overall income? So the Part B premium is based on the modified adjusted gross income that you report on your tax return. And so every year we do see, you'll receive what they call a Social Security award letter, or sometimes it has a different title to it, but we typically see those letters going out mid to late November from Social Security, and it will state that based on the modified adjusted gross that you have, so this year they'll be looking at 2019 for 2021, was X dollars. Based on that, your Part B premium will be X and your Part D IRMA will be Y. And so again, we do have a chart to kind of talk about that here a little bit more in depth in just a few moments, but great questions. And so Marcia briefly mentions how you can get assistance with the Part A deductible, as well as the additional 20% that your red, white, and blue Medicare card does not traditionally cover. So when most individuals think of Medicare, we think of that red, white, and blue card. And that card is for your Part A and your Part B. That card covers about 80% of all of your medically necessary costs that you would receive on Medicare. And then you have two options. Well, you technically have three. Three would be your self-insuring, and you will then pick up the additional premiums, or sorry, the additional deductibles and the additional cost that would be associated with any service. And then you have two additional options, one being a Medicare supplement, otherwise known as a Medigap. So you'll hear those words interchangeable. And then there's also the Medicare Advantage plans, or you may also hear them called Medicare replacement plans. And so with this chart, I think it's very clear. So I like to use it on some of the differences. I will state that for individuals who are electing their Part B for the first time, or you're signing up for Medicare Part A and B when you turn 65, you do have what they call guaranteed issue, which essentially means that no health provider is able to ask you any medical underwriting questions. And so that is very, very important to note, because there is health underwriting potentially with Medicare, and individuals don't realize that, especially in the state of Ohio. So for an individual who selects a Medicare Advantage plan, say when you're 65, maybe you don't take a lot of medications, and they are looking at that lower plan premium, and then goodness, in maybe 2-3 years, there's a health event, and all of a sudden they want to go to a particular provider or go to a particular hospital, and they realize, I want that freedom of choice. There is health underwriting to make that switch. And so they typically are looking 5 years back for there's a whole laundry list of conditions that they look at. And then there's also a laundry list of medications that they're looking at. Have you taken these in the last 2 to 5 years? And so the piece that is often, I don't think, clearly understood is that it's not necessarily that you'll have a higher premium, it's that you're not actually able to apply for that coverage. So you get to a point in the application where if you check yes to taking a particular medication, it will terminate the application and we're not allowed to move forward. So again, when you are making these selections, it's important to take things into consideration. Are you planning on traveling? Is it important for you to be able to have the provider choice or a selection of where you want to go? What if you want a second opinion? So all of those items come or should be taken into consideration. And so with the Medigap or the Medicare supplement plans, which are in blue, your red, white, and blue Medicare card remains primary. And the provider that you select to carry your Medicare supplement, be it Anthem, Aetna, Medical Mutual, Humana, there's a whole variety of them. Whoever you choose would be your secondary. And why is that important on this plan? So for individuals who have that configuration, you may see any provider in the nation that accepts Medicare. So there's no network restrictions when you have Medicare as your primary insurer. The other piece to note is that you're not required to have a referral to see a specialist. You also are able to enroll in a standalone drug plan. So your prescription drug plan and your physicians are not tied together. And then with the plans, there's traditionally a plan premium, but there's also typically set costs that you're responsible for. And so you're able to budget with regard to what are the costs going to be. So for instance, I think sometimes it's easiest to give an example. I got a call from a client that we work with that has since moved to Wyoming. And he called today and said, I just have a general question. We have a friend who unfortunately is going through a medical crisis. And if I needed a heart transplant for whatever reason, what kind of additional coverage would I need? And I said, with the plan that you have with the supplement, you would have no additional out-of-pocket cost other than your premium based on the plan that you have. So you would be in great shape. Hopefully it never comes to that. But if you were to need a heart transplant, you would not have out-of-pocket costs when it would come to the transplant. So he was able to have peace of mind knowing that yes, he has a plan premium, but he wouldn't have an additional surprise as far as costs are concerned if he had to have a procedure like that. With the Medicare Advantage plans, as I mentioned, they're also called Medicare replacement. Whatever company you choose for your Advantage plan, that company becomes your primary insurer. So you are required to have Medicare Part A and B in order to have a Medicare Advantage plan, but Medicare is no longer your primary insurance. And so what that means is that there are networks. And so with an HMO, there are none or very limited out-of-network benefits. With the PPO, there are out-of-network benefits where typically you're paying about 50% of the cost of whatever the insurance is not paying. So definitely a higher cost sharing when it would come to the out-of-network. The other thing to note is that there are certain Advantage plans that may not require that 3 midnight inpatient stay that we talked about. Some of the Advantage plans will cover dental and vision, but again, very important to look at the full picture and see what those plans truly are covering when it comes to vision and dental. And again, there are restrictions and networks with vision and dental in general, but just making sure that your dentist or ophthalmologist is in network. And then the thing to note is that your prescription drug plan is also tied to the Medicare Advantage plan. So where with a supplement, you may have 2 different companies. You may have a company for your supplement and then a separate company for your prescription drug plan. With the Medicare Advantage plan, you typically have 1 company for both. Now there are 5 or so Medicare Advantage plans in Franklin County that do not have drug coverage attached to it, but you're then not able to purchase a separate standalone plan for your prescription drug coverage.
And I think when you're looking at these plans, if you're looking at an Advantage plan, you would start by, looking at the drug coverage and making sure your plan that you're choosing is your drugs are covered. I think that in ease of use, as a geriatric care manager, you have to be more aware. The Medicare Advantage plans can be more cost effective. However, there also can be surprises with those kinds of catastrophic, Emily mentioned, the heart issues or whatever, the bigger catastrophic medical issues, those we can't really plan for, but just know that you will have more out-of-pocket costs with the Medicare Advantage plans that you really can't put a pencil to and know exactly what those are going to be, because there's too much unknown with the medical piece. More so with the Medicare supplemental insurance, you can pretty much budget, know what your costs are going to be straight on. Those answers you can do through research. With the Advantage plans, you really can't, other than to know the cap that once you reach that high number of out-of-pocket costs, then you'll be covered at 100%. And as far as travel, things like that, those Medicare Advantage plans are really regional, and you have to be careful of that. If you're a couple that is a snowbird or plans to travel, have children that live out of state, out of country, or not necessarily out of country, but definitely out of state. If you would ever visit for an extended period of time, you have to be aware of that as well.
Absolutely, and that's a great point. And then I would say that for the network restrictions, we're currently working with a client that has over a $2 million bill because they thought that the hospital that they were going to was in network, and after 6 surgeries, they found out that that hospital was not in network. And so working with provider, the insurance company, and the employer in this situation, and it ultimately comes back on the individual to make sure that that provider or hospital is in network. So again, if you do select that, just make sure that you are reaching out. And I always say, document the phone number that you call, the date and time of your call, who you talk to, get a reference number if possible, and then the outcome of that conversation. So that can be helpful in any of these situations, but that's just best practice, whether you're talking to Social Security or Medicare or anyone, just to note, what information that you're being given and what the outcome potentially could be of that.
And I think too, I have a client right now that had a pretty devastating cancer diagnosis, and she had an HMO plan with an Advantage plan. and wanted to go out of network, or her doctor wanted her to see the specialist. It was a pretty unique type of cancer. See some specialists at the James. And they did get approval to do that, but you have to make sure that every procedure at the James that they're going to do, or they send you to another doctor. The James is kind of a big cancer conglomerate where they use a team approach. You want to keep calling and keep making sure that the insurance is going to pay. You are going to have a higher backside cost with that, but you want to make sure that the basic costs that are covered at that facility, if they approved it initially, is going to be continued even through the scope of treatment throughout your diagnosis. That's important.
Absolutely. And with the Advantage plans, and again, these are just, I guess it's the fine print, right, while you're on this call. But we had a client a couple years ago where the hospital, they were currently in treatment, and the hospital system and the provider fell out of network with their current plan.
Right.
And so we had to have that tough conversation with the client to say, do you want to continue with your providers? If so, the plan options that we have for your prescriptions, it's going to be about $6,200 more for next year. And that is ultimately the route she chose. Or it was, we could have remained with that plan and she would have to work with a different team of doctors and go to a different hospital for that setting. So again, just those things that, as Marcia mentioned, we don't always know what health concern might pop up. So just noting that that decision that you make when you're 65 or making your Medicare benefits could potentially have lifelong impact. And then some additional considerations. So we have been talking about the initial enrollment period, but as I mentioned, there are quite a few individuals that, are remaining on group coverage for a variety of reasons. And I think it's really important that individuals who have greater than 20 employees on a group plan may not be required to take Part A or Part B because of your group coverage that you have. The thing to note is that for individuals who work for a company or their spouse works for a company with less than 20 employees, you are required to have Part A and Part B. And so it is very unfortunate when someone comes through our door and they're like, oh my goodness, I just went to, the hospital and look at my bill. And so what happens is that if you do not elect the right parts of Medicare at the right time, you may be responsible for that hospitalization. Even for a plan that has greater than 20 employees, there are quite a few companies out there that require you to take Part A because it helps with the hospitalization cost. And for most of us, as I mentioned, there's not a premium associated with it. So there's not really a risk, but it does help the group plan overall if someone were to have a hospitalization. What's important to note is that if you are required to have Part A and you fail to elect it at the right time, and you do have a hospitalization, you may be responsible for that hospitalization or a larger portion of that hospitalization because you did not have the right coverage at the right time. When it comes to any part of Medicare, if you elect Part A, Part B, Part A and D, Part B and D, whatever configuration it is, the moment that you elect any part of Medicare, you are not allowed or should not have be contributing to a health savings account. And technically, you should be terminating any contributions to your health savings account 6 months prior to taking any part of Medicare. And so sometimes that's not possible. Maybe we've seen a lot of individuals, unfortunately, forced into retirement or taking retirement earlier than they thought. And so there may not be that 6-month window. Now, you can still use your health savings account. So you can still use those funds for medically for all of the things that you would be using it for in the past. The only piece, and again, we're not accountants, but what we've seen is you can continue to use that for your premiums or if you needed glasses or any kind of dental work. So you're still able to use those funds. You're just not able to make that contribution anymore.
And the reason you need to stop at 6 months before is there will be a tax issue of those 6 months of contribution. So typically that's a non-taxable expense when you pull that ahead of time and put it in your HSA. If you continue, especially if you're a spouse of an employee, your husband, let's say, is working, going to continue to work, you're going to stay on his healthcare. You're allowed to. And he's been contributing for you and for him into a health savings account. It's a joint account. Your name, and you decide to elect to go on Medicare, or perhaps as a spouse, you're not covered under his, you're not allowed to be covered under his health insurance, which is happening more and more, I think, in recent years. So you need to stop 6 months before you know you're going to come off as a 65-year-old and going into Medicare. You need to stop contributing. Otherwise, there's going to be a tax situation where that amount that you paid in for those 6 months will be taxed. So just be aware of that. A lot of people, that's one that really is in the fine print and slips under the radar.
Right. And sometimes
and it
that's
can be
years.
Significant.
Yeah,
Yes.
Years of contributions if someone doesn't retire until they're 70 or whatever it may be.
Exactly.
So very, very important to note. The other piece, as Marcia just mentioned, are you the employee or the spouse of the employee? And so, as she mentioned, we're seeing more and more companies not choose to cover a spouse after they turn 65,
Yep.
or they require a different configuration with your Medicare. And the other piece to note that I didn't mention here is, sometimes individuals maybe are on long-term disability. And so that also, if you're an active employee or if you're on disability, that also changes the configuration of the Medicare and the group coverage. And then there's the creditable drug coverage. And this is where we also see individuals get into a situation with a penalty. Even if you have group coverage and you have greater than 20 employees, every year, if you're remaining on group coverage, you should receive a creditable drug coverage letter from your employer or from the third-party administrator. And that is very important to note, to look at, and then I say to keep that on your records forever. So that is a not trash it in 7 years. I say hold on to it, scan it, copy it, frame it, whatever you need to do. But truly, so if you are required, so if you get a letter and it says your drug coverage will not be creditable, that means that you are required by Medicare to elect a standalone drug plan. In order to elect a standalone drug plan, you then also must have Part A or Part B. And so this is where it can get pretty tricky, especially if you're contributing to an HSA. All of a sudden, you no longer have creditable drug coverage, so you need to elect Part A and Part D, and then that health savings account contribution continues, and then it's like, oh my goodness, I didn't realize. So again, just really important to note. We will talk about these penalties on the next slide, so I won't go into details right now with what those look like. And then COBRA. So COBRA is not considered creditable coverage with Medicare. So for individuals who are over the age of 65 or who have Medicare due to disability and are on Medicare, COBRA is not considered creditable coverage. So very important to note that before your special enrollment period were to end, that you do elect your Part A and Part B. If you say continue on COBRA for the 18 months, right, there's going to be a penalty for doing so because you did not appropriately elect your Part B. More than likely you did not elect your Part D. And then as I mentioned, if you miss that special enrollment period that you would have, then you also have to wait until that next general enrollment period in order to elect your coverage to start the following July. So again, very important that if you are in a situation where you will be electing COBRA, that you understand how that works with Medicare and that you are required to have A and B.
And right now, if I didn't know what I know, I'd be freaking out in what we just on this slide, especially. So just know, you know, in this particular, we're giving you the information, but just know there are people, you know, Emily, the Ohio Department of Insurance, there are people out there to talk to that can help you through this. So just know that when all this starts to mount and, you know, what do I do? What do I do? Talk to people who know, and we're out there to help.
Absolutely. Absolutely. And we talk to many HR departments. So we work hand in hand just to really understand the configuration and then just to ask some of those next questions that if you're not in this every day, you might not think to ask.
Exactly.
So we're here for you. So, the penalties to avoid. So as I mentioned, most of us will receive Part A premium free due to our work credits. However, if you do not have that luxury and you are required to pay a monthly premium for your Part A, and you fail to elect it within your initial enrollment period or during your special enrollment period, there's a 10% penalty on the monthly premium. And the one thing about this penalty that is nice is that it's not lifelong. So it lasts twice as long as the number of years you didn't sign up. So if you didn't sign up for 2 years, your premium would last for 4. If you didn't sign up for 4 years, your premium penalty would last for 8 years. So then it would go back to that base premium once that 8 years or whatever that time frame looked like. The Part B penalty, however, is 10% for every 12 months that you failed to elect that coverage. That penalty is lifelong, however. So if individuals maybe didn't have their coverage that they needed for 12 months, it would be a 10% penalty. For 36 months, it would be a 30% penalty. And again, that penalty is lifelong, and that's on a monthly premium that is technically, and most often what we see, going to go up over time. So again, this is one of the reasons it's important to just get counsel if you're not sure. And then the Part D premium penalty that we mentioned is a 1% penalty per month for every month that you do not have creditable drug coverage when Medicare says that you should. So again, this is often the penalty that we see. And again, this is lifelong. And where we typically see this penalty kind of sneak in is for individuals who have group coverage that didn't realize that it wasn't creditable, or so often individuals are 65 and don't take any prescriptions, or when they are electing their coverage, they're like, oh, I don't take any prescriptions, I don't need Part D coverage. That is not true. And so, then all of a sudden it's 4 years later, they get a prescription and now they have a 48% penalty. And that again is on that annual average for the nation, not for your particular plan that you're on.
And I will say too that in that last scenario that Emily described, a lot of us that are turning 65 are much healthier.
Mm-hmm.
So we think, oh, why would I pay that monthly premium? I don't care if it is only $13. I don't need to pay it. I'm just going to pay. And with, the drug help companies that are out there, I don't need to worry about this. Well, long and short is you get to be 80, let's say, which is the folks that I deal with
Mm-hmm.
a lot. They turn 80 and you have some kind of chronic health problems. Your drugs accompany those chronic health problems, and you're going to live to be 90. I mean, we live longer than our expectations, and you need the drugs to stay healthy and to continue to fight the disease process that you're battling. You wait from 65 to 80, you're looking at 15 years, and that's a problem. Mm-hmm. That's a whole lot of penalty.
Absolutely. And again, it is lifelong, and it is one that is not one that we see that there's an exception for. So,
and the other penalty to avoid that I would re-mention is with the HSA, the tax
mm-hmm. penalty
to stop that 6 months before you sign up for Medicare.
Absolutely. Thank you. And so we mentioned IRMA, which is not the hurricane from last year, but this is the income-related monthly adjustment amount. And as a reminder, the IRMA is calculated on your modified adjusted gross for 2 years prior. So these are 2020 rates. The 2021 rates have not been released yet. We're waiting on a couple of things. There's the HEALS Act, the HEROES Act. If those acts are signed and put into place, then we are told that these premium thresholds will remain the same. If not, I'm assuming that they are going to increase, even if by a little bit. We typically see that they increase just a touch every year. And so what's important to note on this slide, so I know it's busy, so I'm just going to give each of you on the call just a moment to find yourself. So there's an individual column, a married filing jointly, and then married filing separate. So if you just look at that base, the premiums there, or the modified adjusted gross there, then we will talk about this slide a little bit more. And if you can't, or you aren't sure, we'll just go with the tier 1. And so again, this is a slide that every year they're going to adjust this. Again, like I mentioned, it will be typically in November when you'll receive a letter from Social Security saying that Miss So-and-so, Mr. So-and-so, we have that you married filing jointly and that you made $202,000 in 2019. Therefore, and I'm just using for next year. So therefore, your Part B will no longer be $144.60. It will be $202.40. And then you will also be responsible for a $12.20 per month additional Part D IRMA. And then you would also have your plan premium for your prescription drug plan. And so that's an increase of so that would be $214 plus your drug plan premium. I think one of the most important things to note on this chart is that if you're married filing separate, after the age of 63, I would talk to your accountant, your financial advisor, the Medicare professional that you work with to really have that conversation, because there is a penalty. If you are making over that base threshold for your modified adjusted gross, as you can see, you go from the base to tier 4. So you would jump from $144.60 to $462.70. So that's a significant jump for individuals who are married filing separate. The other piece to note on this slide is that these are per month per person. So if you and your spouse are both over the age of 65 or have Medicare due to a disability, then these figures would apply to both of you. So it's not as a couple, this would be individual. And so the last thing I like to see is an individual comes in at 64 and 9 months thinking that they're going to retire. They've planned for the base, the $144.60 plus the Part D premium, but maybe they sold property or took some distributions, or as we are in the last years of our career, we tend to make the most money that we may have ever made. So not really having a clear picture of what their premium may look like. So I always encourage individuals 62 and a half to 63, really talk to your accountant, your financial advisor, your Medicare professional, just to really start planning for the financial impact that your decisions that you make in retirement will have on both your Part B and your Part D premium.
And I would say too, one thing to remember, even after you starting on, this is lifelong while you're on Medicare. Okay, so you go to 65, you do all this planning. Yeah, we know what it is. We want to stay under that amount when we take our distributions after we retire. The biggest thing that I see as a problematic is a farm was sold, or the kids buy out the mom and dad for the farm or the business, and they take a big distribution. That's income. Anything that's income. The other thing I see a lot of is maybe 2-3 years into retirement, you have this nice nest egg. The kids want to start a business. The kids want to buy a home. Oh, we'll help them now instead of leaving it to them when we pass. You pull that extra money out of your distributions. That's taxable income. It's going to show up as income. Just because you helped your kids, gave them another $100,000, let's say, or however much you give them, but it's enough to put you over into the next bracket so that now you're paying a higher plan premium. You have to take this into consideration the entire time you're on Medicare, not just when you turn 65. And that's a big thing to remember. You have to be able to say no to the people that maybe need the money now, no matter how much, because it's going to directly affect your monthly costs for your health care. And I see that a lot in counseling with Medicare, that people have been generous with their children or whoever it may be, and it's ended up costing them a lot in the as far as their premiums. It increases their plan premiums every month for a period of time.
Absolutely. And I think the other thing to note on that too is that sometimes it makes sense to take, and again, not an accountant, not a financial advisor, but to really work with those parties to say, maybe it makes sense to take out a higher amount 1 year. So you're paying this premium higher for 1 year versus taking it out over 3 years, and then you're paying the higher premium for 3 years. So obviously there's a lot of tax planning that goes into that, but those are some of the things that we often see. Now there is a form that you can fill out for life altering life events that may happen that change your financial picture. So whether there's a work stoppage, or unfortunately maybe a spouse passes away, or maybe you go from full-time to part-time. So there is a form, and they may take that into consideration. Now, if you're at tier 5, they may not drop you all the way to the base, but they may take you down to tier 4 or to tier 3 if there is a life-changing event.
I actually had a gentleman that won money through a gambling golf thing. It was bizarre. I've never heard that you could win that much money, but it put him over only by $47. And he had been retired for some time, and he did fill out the form. Because it was only a small amount, they did allow it. So there is hope if it's a small amount. Sometimes it's worth putting in the ask to ask for reprieve, and they will do it. But yeah, it's something you have to pay attention to.
Absolutely. And if there is one slide to pay attention to during this entire presentation, it is this one. So every year, for individuals who have a standalone drug plan, their Part D, or a Medicare Advantage plan, you have the option to evaluate your coverage and ensure that the coverage that you have for this year is in fact going to be the most comprehensive plan for you for the following year. And even if nothing changes on your end, you are in the same house, you're in the same county. Obviously, if you're in the same house, you're in the same county, unless your county's moved. But if you take the same prescriptions, if you see the same physicians, it's the same dosage, the same frequency, you go to the same pharmacy. The plans oftentimes change every single year. So you may have a situation where your pharmacy goes out of network, or one of your prescriptions falls off a formulary, which means that you're responsible for 100% of the cost of that prescription. So there's just all sorts of variables that can go into that. And this enrollment period is for individuals who are not receiving their coverage through a retirement group. So if you are a part of a retirement group and you receive your health benefits, it is important to note when your open enrollment period is, because it might be different than the one that's on the screen. So again, this is for traditional Medicare with a supplement and a prescription drug plan, or for an Advantage plan. And so with the prescription drug plan, some of the key things to look at when you are making the comparison of the plans, as I mentioned, there's over 26 for Franklin County. You're first and foremost going to be looking at your zip code and county. So again, if you are, say, in July and you move out of your county, it is important that you would speak to the company that's your prescription drug plan or your Medicare Advantage plan to ensure that you have the same coverage, or do you need to elect another plan? Whether what pharmacy you have, and whether you are open to mail order, or do you prefer mail order? Your prescriptions, again, the name, the dosage, and the frequency. Are you taking generics, or must you take the brand name? Do you prefer 30, 60, or 90-day refills at the pharmacy? Are all of your prescriptions on formulary? What are the quantity limits, and are any of your prescriptions outside of those? Are there any prior authorizations that you need to be aware of, where your physician needs to submit authorization prior to getting approval to get that prescription each and every time? And then step therapy, which essentially means that there are 1, 2, 3 different medications that the plan wants you to take before they will pay for the drug that your physician has prescribed. And then in addition to that, for the Advantage plans, as we mentioned, there are networks that we have to think about as well. So any network providers, your primary care physician, any specialists, any home health providers or outpatient rehabilitation centers that you might want to go to should you need those services, or are currently in treatment now, and that treatment will continue the following year. Your hospital preference, any skilled nursing facility that you would want to consider should you need to frequent one for some rehabilitation, durable medical equipment that you may need. And then there are additional providers that we don't have listed on here. And then at this point, hospice, you would revert back to traditional Medicare, but there are some current carve-outs that are being worked on. So hospice provider might be one in the future as well. And so I think sometimes just looking at some comparisons. So these are comparisons that we have done personally. And so the first one is a pharmacy comparison. So this is the same exact plan, but by selecting their current pharmacy it's $6,700 for the following year for the same list of prescriptions, or by making a switch, it's $567. Or even if they went mail order, it would be $228. And so it's not often a situation where maybe making a switch to a pharmacy, if you have a great relationship with your pharmacist, would be the best call for you. But there are certain times where individuals just don't have the additional $6,000 to spend.
Right.
And this number could look very different than even $6,000. So for this particular client, they saved $6,100 by doing a comparison for that year. This is a prescription drug plan comparison, and the current plan for that particular client is on the right. And as you can see at first glance, the plan on the right looks to be the better option. Cheaper premium, cheaper annual drug deductible. However, once we plugged in their prescription drugs and their preferred pharmacy, you can see that it's a savings of $33,000 by simply making a switch for the following year. And then a Medicare Advantage comparison, why it's so important. Again, the